Hi there, I'm Mr. SafeHandZ, here to give you advice and information about addiction, mental health, rehabilitation, and recovery. Today we'll discuss the stigmas that society has towards addiction and addicts. The word stigma means a mark of disgrace associated with a particular circumstance, quality, or person. Social stigmas are a way of people to judge others based on a certain belief that they hold, regardless of whether it's been proven wrong. In the case of addiction, many still believe it's a reflection of a person's character, like weakness, delinquency, or gullibility. On the contrary, science has long since proven that addiction is a disease of the brain. Addiction is a primary chronic brain disease of brain reward, motivation, memory, and related circuitry, as described by the American Society of Addiction Medicine. The National Institute on Drug Abuse in the US also defines addiction as a chronic relapsing brain disease that changes the structure and functionality of the brain. So why do so many people still think of addicts as drunks, crackheads, or junkies? Unfortunately, these perceptions have existed for as long as there have been addicts. Governments often treat drug addicts as criminals, and even some in the rehab community use rather despicable terms which help propagate these stigmas. On top of that, employers often fire employees who are addicted. Families often try to hide their addicted loved ones from society to avoid tainting their standing, and in the hope that addicts will grow out of it or that the phase will pass. These perceptions lead to most people bullying and disrespecting addicts. This drives them deeper into their addiction as they feel cornered, misunderstood, and ridiculed, or suffer from pain, stress, and depression. And one of the worst consequences is that they will often refuse treatment or leave it halfway to prevent people from finding out their problem. This path can lead to overdosing and even suicide. Now, do you see why these stigmas are so deadly? Let's take a deeper look into the worst ways that stigmatization can affect those suffering from this disease and what needs to be done to make things better. Now, if a person gets into rehab, they believe, and rightly so, that society will start seeing them differently instead of commending them on taking the road to recovery. This, coupled with guilt, shame, and the effects of stigma, leads the addicted to shy away from treatment. And this can be fatal. Without treatment, the chances of overdosing, depression, and suicide grow by the day. Remove the misconceptions and the stigma, and addicts would find it easier to find support. Now, as strange as it may seem, many doctors are not as well informed about addiction as you may think. Often, doctors recommend patients to a 12-step program or a support group instead of directing them towards medical, evidence-based resources. Such programs have helped many addicts, but not all. And those who they can't help find themselves lost with nowhere to go. It's about time medical professionals started seeing addiction as the disease it is and send their patients to get better scientifically supported treatment. Funnily enough, even psychiatrists and psychologists have a tendency of considering substance abuse patients to be untreatable and refuse to treat them before they get clean. This is such a massive problem because mental health issues may well be one of the causes of the addiction in the first place. Or maybe psychological treatment is required for the patient to recover. Now, many clinicians dismiss what patients tell them and blame it on just the drug stalking. So you see, this helps no one. This way, the addiction stays, and so do the mental diseases that could well be related to the addiction. Wouldn't it be amazing if psychotherapists could consider substance abuse as a disease and equally worthy of treatment? In India, using drugs is illegal. This really is testament to how deeply ingrained this stigma against addiction is in our system. This in itself leads to the lack of treatment, let alone subsidization of rehabilitation in our country. If we could somehow show our elected representatives the facts behind drug addiction and usage, there would be a massive change in how addicts are perceived and treated, don't you think? But convincing them of these facts would be so difficult. Now, when a patient enrolls into a rehab program, they're very vulnerable. They've been fighting the addiction for so long that their guilt, shame, and feelings of failure become constant. Their brain chemistry has been so altered that their mental health becomes volatile. This makes it all the more important for recovery centers to be especially sensitive to their patients. If all the personnel don't go through the proper sensitization training, some of them may hang on to the stigma attached to the addiction. This could surface when they are interacting with the patient and reinforce the negative emotions that the addict is already going through. So always make sure of the quality of the center you're getting into and confirm that they take these factors into consideration and also involve the patient in their own recovery plan, like choosing modes of treatment and setting their own goals. Now, another serious problem is that people in rehab are still regarded as weak and susceptible to relapse. This would affect patients even after they leave the rehab program and start recovering at home. Every day, their family, friends, and colleagues would question their ability to stay clean. This would act as constant hurdles for the ex-addict and sometimes even hamper progress. Imagine how much quicker a person could recover without all the stigma he or she faced every day. And people in recovery find it so difficult to hold on to jobs, and they have to face so much more in addition to all the questions and criticisms that are thrown at them. Others who recover from a normal disease feel proud that they've beaten back their illness, but those who went through addiction and recovery can't raise their heads that high, as they always have to face the stigma that society holds for them. But we must do something about this. Each one of us can contribute to spreading awareness of addiction and help society break free of its stigmas. What we must do is talk about how addiction is and how it's been seen by society and how it's wrong. Show people how addiction is a disease and it doesn't reflect on the character of the person going through it. Rather, we need to support these people instead of shunning them. If you know someone who has an addiction, be supportive and show them that you know what they're going through and that you understand what they're going through. Thank you so much for listening to this episode. This podcast has been made possible by SafeHouse Wellness Retreat. You can find out more about us at safehouse.co.in. We really hope this helps in opening minds, starting conversations, and helping those suffering from addiction to come to terms with their condition. If you have any questions, please leave us your messages here. We really do try to help and do our best, and we'll get back to you as soon as we can. This is Mr. SafeHandZ wishing you peace of mind.